Hi, I'm Lauren. I'm a hand and wrist specialist physiotherapist and I work here at Pure Sports Medicine at our Moorgate clinic on a Tuesday, Wednesday and a Friday. So I'm here to show you a few different splinting options for the wrist, the thumb and the fingers. So this is our Exos wrist splint. It's a fully mouldable and then becomes absolutely rigid wrist splint, which is great for wrist fractures, scaphoid fractures and severe soft tissue injuries. It goes into an oven, it softens itself down completely in about 5 minutes, and then you mould it onto the patient and it hardens itself up. You use the boa system to tighten through the laces, and then once it's on, it hardens up around the wrist, and the next thing you know, it's a completely rigid splint that immobilises you for the length of time that you need to be taking the wrist out of action for. So this is a finger gutter splint, ideally used for fingers that have been injured, particularly the middle joint of the finger. Either it's been dislocated or stressed in one direction or another, and the ligaments or the volar plate have been injured here, or even some tiny fractures in there too. So you mould the splint to straighten out the finger and help protect it from either being re-injured or prevent it from contracting, which is what can happen with the finger when it's injured. It tends to bend and then tighten, and next thing you know, the finger isn't completely straight. And then it can also be used for sports and hobbies for after the healing process has taken place to prevent further injury down the line and help keep the finger nice and comfortable. This is one of our thumb immobilisation splints. The idea is to keep the middle joint of the thumb nice and still after an injury such as a dislocation or an ulnar collateral ligament injury, which is like a skier's thumb injury. You can wear it day and night, and generally they do tend to be worn for sort of 24 hours a day after that sort of injury to help protect the ligament and allow for the healing process to take place. It can also be used after surgery for a similar injury or for other injuries to help keep the joint nice and still and help protect it so that it doesn't get injured after a surgery. So this is our mallet splint for a mallet finger injury, which is either a rupture of a tendon across the back of the finger up to the tip, or an avulsion fracture where the tendon pulls a little bit of bone off. Either way, the joint needs to be completely immobilised for either 6 or 8 weeks, depending on the diagnosis. And it's laid on the back of the finger to keep the finger nice and straight, taped up in the straightest position possible, but still allows the finger to move and to be able to function for typing and things like that, but will completely immobilise the finger and allow the healing process to take place. So that was an example of 4 different types of splints, but there are loads of others that I do make that, you know, if you want to give me a shout and find out what I can do, then absolutely let me know, because there's plenty of different parts of the hand that do need immobilising and can be splinted in lots of different ways. So just give me a shout and I'll be happy to answer any questions.